Hello, I'm Ishant Rana, a clinical psychologist from Tulasi Psychiatric and Rehabilitation Center. I'm going to tell you something about cognitive behavioral therapy. It's a therapeutic approach which is absolutely essential in the therapeutic community. That's the program that we are doing in the rehabilitation centers. It's a kind of therapy in which we are teaching the patients those therapies or those techniques in which they can identify their patterns of thinking. Because as they say, the things are is not in that way that as they are, but things are on that way that as we are thinking about them. Whatever is happening in our scenario is not in our control, but our thinking is in our control. The cognitive behavioral therapy is a mixture of two therapeutic approaches. The primary is the cognitive therapy and the second is behavioral therapy. In cognitive therapy, first of all, that we are giving the lessons to the patients in which they could identify their learning patterns. Exemplary, sometimes a little failure if happening in the life of a patient, of an individual, he is taking it as a ends of life. Sometimes somebody is rejecting to him or her, he is taking as a complete failure or worthlessness. So these are the patterns, we call it cognitive distortions. In cognitive therapy, we are giving a therapeutic approach to the patient in which they are learning and identify those things in which they can change their patterns of thinking. But the thinking is not just the only way. There is another thing, the behavioral techniques. Because in our life, it's a mixture of three important phenomena: the cognition, the feelings and the behavior. So in cognitive behavioral therapy, we are adopting the second phenomena, that is behavior. Sometimes we can take an example for this. Sometimes we can get an anger outburst. This is an emotion, but in the real world, we are doing an action of that anger. So in behavioral therapy, we are identifying those emotions or those feelings or those patterns of thinking in which we have to work, we have to show a behavior, or we are not showing a behavior. That kind of things we are understanding in the cognitive behavioral therapy. In Tulasi Rehabilitation and Psychiatric Center, this is the basic approach that we have. We are understanding in the cognitive behavioral therapy. In Tulasi Rehabilitation and Psychiatric Center, this is the basic approach that we have included in our therapeutic plan. In the therapeutic plan, the cognitive behavioral therapy is the basic emphasis that we are doing with the patients. In relapse prevention counselings, in motivational enhancement therapy, and in other approaches, as we can say is the Alcoholics Anonymous, cognitive behavioral therapy is having its impact in all of them. Basically, the basic prayer of the Alcoholics Anonymous program that we can say, God grant me the serenity to accept the things I cannot change, and give me the courage to change the things I can, and give me the wisdom to understand the difference of between two things. So in which we can identify this serenity prayer is the basis of cognitive behavioral therapy, in which first of all we are trying to identify those things we cannot change. So that is the cognition, and in the behavior we are asking for the courage for the thing that we can. So it's a mixture of those two things. And for conclusively, I will say cognitive behavioral therapy is the most important part of our treatment phenomena. We are just taking it as the important aspects of our treatment approach. So thank you so much for this.